Welcome everyone to the Wednesday morning series. Dr. David Fawcett is back after it feels like forever. But he's been busy, we've been busy, so it's just great to see him. So I want to start out with, I was talking to my husband and he was like, he'd read some information. Now he's just a normal guy, no addiction other than dealing with a wife who is. But he said, do you know what, pot, cannabis, do you know what the strength is? Like back in the olden days, I think he said it was 4% strength. He said, guess what it is now? And I guessed 50%. He said, no, there are some that are 90%. And I about fell off my
Oh my
chair. So
God.
I know. I just was like, so all of the things that,
Wow.
you've talked about with the negative consequences and
Yeah.
psychotic breaks and things like that. I was like, how could they not be happening, with that level of concentration? And I don't think that there's really good regulation. And I think there's still the misperception that it's just pot, so um
Right.
yeah.
Right.
So I
That,
I side I sidewinded us, but I like that was like so top of mind because I literally was like, oh my gosh, that is just insane. So
that's interesting. I had not heard that number, although I'm really not surprised because when you look at admissions to hospitals and treatment programs, we're getting a lot of cannabis admissions, which if we had the assumption, like probably you have my assumption, like back in the old days, we had like twigs and it was like crappy stuff, right? You couldn't really do anything with it. That's not today's pot. But we're getting people that are admitted now with psychotic disorders directly related to their cannabis addiction. And of the studies that are coming out now, two drugs lead to psychosis more frequently than anything else, and some of which also lead to schizophrenia and other really serious
mm.
permanent disorders. The two are cannabis and methamphetamine. So it
Oh,
kind of
interesting.
it's a different company than you might think it is, as kind of a harmless, often legal, you know, substance that people are ingesting. So yeah, I think it's all of us have that assumption. It's legal, and so it must be safe and fine. And it's just we're seeing this uh, very careful cultivating of these strains that are really, really highly powerful and dangerous, frankly. So yeah, that's kind of a staggering number. I hadn't seen that, but I'm not surprised.
Yeah, well, I was so
Wow.
I veered us off in a direction, but did you have thoughts or a topic for today?
Well, yeah, just and it's related actually. I wanted to make an observation. As of course, my thing is this what we call sexualized drug use, or this fusion of some kind of substance misuse or addiction with some kind of sexual or porn misuse or addiction, right? And sadly, in this country at least, the professionals that work with those two issues get trained in kind of one or the other. And so we have a lot of substance abuse professionals who are really do a great job when it comes to alcohol and drugs. But they have kind of this weird blind eye toward the behaviors that go with it, like sex or porn or gambling or food or exercise or work, all that stuff. They kind of just write off as well. Let's get the drugs worked out, and the sex will take care of itself. And we know that's not true. And but lately, what I wanted to say is I've been seeing the other side as well. People that are trained dealing with more of the sex and porn side of things, and that can be CSATs, it can be other kinds of therapists, but that also kind of turn a blind eye to the substances. And it's interesting you mentioned cannabis because I've talked to a couple, just informally, a couple therapists lately who treat sex and porn addiction, who kind of minimize the role that cannabis might be playing in the lives of their clients. And you and I know that for a lot of people, those two become one and the same. And a lot of times people won't be interested in their porn addiction until they have a little substance on the side. A lot of people pair cannabis and porn, for example, and without one, they can't get as high as they would like, and they need them both. And so if we just don't worry about the cannabis and focus on the porn addiction as a well-meaning therapist, that person is probably going to relapse because we're not treating the whole addiction. We're treating just part of it. Or people will just switch from one to the other. I remember at Seeking Integrity, I had a client who was a meth and porn addict, and he got in trouble with the law and he couldn't do porn anymore, but he had this whole stash of methamphetamine, but he couldn't really get high from it, although he desperately wanted to because he didn't have the porn to go with it. So in a very real sense, these things, when they combine, they combine, and it's really hard to get as high as you want without both of them in the equation. And I think if we just ignore that and say, well, let's just worry about your sex addiction or your porn addiction and don't look at the alcohol or the cannabis or the work or other stuff that go with it, it's what I call just whack-a-mole, right? We're treating one, and then something else is going to pop up until we deal with the whole system. So it's just interesting. I've seen it long for years. I've seen it on the substance side where they kind of just turn a blind eye toward the sex and porn addiction. But lately, I've been seeing it in reverse too. A lot of well-meaning sex and porn therapists who don't really give full recognition to the danger, the risk of the substances that their clients might also be ingesting. So it's just interesting to see the patterns continuing.
And speaking of patterns, and I know we've got some questions, but like I'm wondering, like in those scenarios, is it like I start with the pot and then go to the porn, or do I automatically go to both things? I was just talking to someone about cocaine and prostitutes, and their belief is if the sexual things stop, the drugs would stop because they're so paired. And I'm thinking there's probably some truth in it, but is there, alcohol that starts this whole thing? I mean, like looking at all of the entire pattern, and I hear what you're saying, and I find it on, kind of across all manner of therapists. It's like this is what I treat, and so this is what I'm going to look at treating, and having that holistic, approach is harder to do. Now, I think the Seeking Integrity clinical team does a great job of looking at all of those things, whether
Right.
it's, gambling or gaming or whatever it is, food, like all of those things, because, we use 12-step language, happy, joyous, and free. You can't be happy, joyous, and free if you're continuing to use something else that is, numbing you out, helping you escape, keeping that dopamine going. I was talking to a therapist earlier today, and said, we're non-smoke, non-vape, and I quoted you, and I don't even know if the statistic is still true. Things seem to change, but I said, you had said, as I recall, that you're 9 times more likely to relapse on any form of addiction if you're smoking or vaping, and so keeping that going, like lots of people go, well, it's just smoking or vaping, and that's okay, versus these really problematic behaviors. But I'm like, but you're keeping this whole door open, so it's probably just a
Right.
matter of time before you're doing something else.
Right. And I think nicotine is the perfect example of that because it keeps that addictive motor running in your brain, right? It never totally shuts off. And cannabis, sorry, nicotine for complex reasons kind of gets cycled a couple times in the brain. And so that's why people, so it's just nicotine. It's easy, you can measure it. It's still, by the way, just a regular hit of nicotine gives you more dopamine than an orgasm. So you can kind of see how powerful it is, but it's still running there in the background. So yeah, I think that I don't know that's exact statistic, but I would say that's still pretty close. If there's any current research on the risk, the multiplier effect of using nicotine as the risk for kind of general sobriety for whatever your substance or behavior is that you're trying to stop. To your other point, I think I've seen this a lot with sex addiction and porn addiction, where obviously those are the behaviors that are causing havoc in people's lives and the lives of their partners and families. And sometimes, very often, I always encourage people to look at their what I call the addictive ritual. Like, when does this whole thing start? And we know that, there's a relapse before the relapse, right? There's a series of decisions and thoughts and things that can happen days, weeks, even months before somebody actually goes to their bottom line behaviors or picks up a drug that they're trying to stay abstinent from. And oftentimes that just includes a beer or two. I've had many sex addicts who um, can identify once it's kind of pointed out, and they do kind of get honest with themselves. Well, yeah, it all starts with a beer or two, which disinhibits, it just opens the door. So maybe that's all, maybe that's the only intake they're making of alcohol. It's just a beer or two. And the, taken on its own, that's not such a big deal, right? But if it opens up the door to all these other behaviors, because what does it do? It disinhibits the person. I've had people even relapse on meth because, well, it's just a beer. Meth is my problem. But now suddenly I have a beer or two, I'm feeling a little bit good, and the thought of getting high on meth doesn't seem so crazy anymore. It just kind of opens the door. So I think really looking at one's individual, and it's like a fingerprint, and that pattern of what comes first, what thoughts, what feelings, what substance, what behaviors, really helping people recognize this is my pattern. And if I kind of ignore some things that often can set it off, that's a real problem. And so the other thing too is that oftentimes people don't have the effect they want if they take some piece out of the equation, right? So maybe I'm a porn addict, but if I'm used to looking at porn with cocaine or cannabis or some other drug, it's not going to have the same impact. And my chances of then using both are greatly increased. Um, so I think in that case, if we just take one piece out of it, we're really not doing the person a favor in terms of long-term sobriety because they're going to really struggle. And I see that, by the way, with clients. Um, I'd have a Camp Sex support group on Tuesday nights here on sex and relationship healing, and some of the guys in there are years sober. They're 5 years, 10 years sober from methamphetamine and other drugs, but the drug is so tied with sex still, and they've been unable to heal that connection or break the connection, that they're sexually anorexic because every time they use sex, and these are people that are married, they should be having a sex life, but they're afraid because every time they use sex or get involved with sex, they relapse on drugs. And so that's obviously something for us to work on healing with those folks. But that's how strong this pairing is. And many times for the substance users, especially the chemsex users, the only way they can stay sober is just not to have sex. And that's not an answer, obviously. But that's the kind of homemade solution people often arrive at, which is really sad, I think.
Yeah, yeah, and I agree. So my message is there is help for healing. It doesn't have to be that way. Dr. David is saying the
Exactly.
same thing. What you're like, there are substance programs, substance addiction treatment programs that permit people to smoke,
Yeah,
and
most of them.
thank you. We're a non-smoke, non-vape facility. But yeah, and there's this misperception that like, well, that, and I had somebody that reached out not too long ago, and it was the client needs to smoke. Like the therapist was saying, the client needs to smoke, and I was like, yeah, but it was going to be a deal breaker, if we didn't permit that. And I said, I can
Wow.
tell you that we've had lots of clients who have come to our residential program who thought they needed to smoke and they didn't, and we helped them with that because we wanted them ultimately to be successful with recovery. Now that client, I said, but we're not going to change the rules, for your client who perceives they need to smoke. So it was one of those where, that client chose not to. I informed the therapist about, that client is unlikely to really get happy, joyous, and free, so we're here and, we'll see what happens. But it's sad to me. So like they're literally going off for help in a different place and they won't get the help that they need because it will be not as complete as they need it to be. Like we talk about, the easier, softer way. Well, at some point, yeah, it's hard to stop smoking. It's hard to stop all of these problems. And, if we really want to be on a path that is different and have success long term for it, we need to be willing to do that. And then not get stuck like you're talking about with the co-occurring and that they're so fused, then working with a qualified professional and, sex can look different ways and things like that. So, and helping, heal those things. So there's help in healing. There's real help in healing for moving forward and having a full life that's complete and not stuck in those problems. So the first question,
Uh,
and we hope that there's more. Go ahead. Did you have something else?
I was just going to say, I think a lot of times therapists talk themselves into thinking, well, you know, the XYZ, those are the main issues. this other thing isn't so big. If we could just get the main stuff dealt with, we can deal with the secondary stuff later, right? And just that never works out. We'd have those best intentions. Yeah, maybe sex addiction is destroying somebody's life, and is nicotine so important in that, in the great scheme of things? Well, if it's a totally integrated into the sex addiction ritual, yeah, it is, right? We have to deal with all that. Plus, I think it's just easier in a supportive place like Seeking Attorney to just go and get it all done at once. Why piecemeal it? It's water torture, just dragging out over and over again. And I think and it never happens. It just ultimately that little the leftover residual substance addictions or whatever behavioral addictions that we leave to deal with later cause the whole thing to collapse. And so I've never seen somebody with long-term sobriety get it by doing that. That's a dangerous strategy, I think.
Yeah, no, and I agree, and I know that there's pushback from clients, and so they'll go, well, at least they would get help with this, and yes, theoretically, but if you're constantly going back to the substance programs because this keeps happening, then has it really helped? And I always
Exactly.
say, I often say, at Seeking Integrity, if we're not your first treatment program, we want to be your last. And I give people a ton of credit for like being willing to keep going back, trying again another program, like time, money, like, and just hopelessness of like, oh, is this ever
Yeah,
going to change? And so yes, being able and willing to do what we need to do, in this moment. And yes, it's like we're just going to rip off the band-aid and we're going to deal with everything, and move forward,
exactly.
in a different way. So
Exactly.
okay, first question. New here. So if this question is irrelevant, what part of it's not. Now, what part of ADHD plays into recovery? I'm diagnosed with ADHD and still struggling with recovery. And would you recommend a certain pill I currently take while Wellbutrin? You've asked the right person.
That's a really great question. Um, the relationship between ADHD and addiction is something that's a really hot topic right now. There's still a lot of research being done on how they interface, how they play out. What we know in simple terms is that the ADHD brain really craves dopamine, maybe more than somebody else's brain, as does the addict, right? Dopamine is the key neurochemical that causes the high and causes us to feel good, and it's the reward that keeps us coming back. So in a way, somebody with ADHD is kind of pre-wired to succumb to addictive behaviors more easily than not. And so it's a little bit of a setup. And so I think just not that it can't be overcome, not that you can't get better, obviously, but it's a really good question because it sort of is that warning piece. If and I just as you may or may not know, I deal a lot with amphetamines, and amphetamines are the drug of choice for dealing with ADHD behaviors because they work, they help focus. And so a lot of my amphetamine users, probably more than half, will say, I'm self-medicating, and they probably are to some extent. The problem is drugs of recreational, so-called recreational drugs, and methamphetamine, cocaine, like such overkill, it just demolishes the brain in other ways. So any possible benefit you have for the ADHD is kind of lost in the damage that's done by the drug itself. Now, that said, there are prescription meds. Wellbutrin is not always one of them for ADHD. Wellbutrin is a great antidepressant, works on dopamine, a little bit of a stimulant. So in that sense, it's related to the traditional ADHD drugs, which are often typically amphetamines and related to dopamine. Those would be more the Adderall, the Ritalin, the Vyvanse, those kinds of drugs. For certain people, they're very effective. However, I think for people that have addictive inclinations, especially if that may involve amphetamines or sex or porn, those drugs can be especially dangerous because they really do start to amplify the addictive impulse. The I've had meth clients trying to stay sober from amphetamines, talking about taking their Ritalin and their Adderall, and they can feel the speed kind of in their system, and it's very triggering to kind of have that sensation all the time. So there are non-stimulant ADHD meds. Strattera being one. Oftentimes people don't like them as well because they don't have that kick, right? They don't have little bit of like I'm taking something a little zingy here, but they tend to work with the ADHD. So I guess the whole thing would be just buyer beware. If you have ADHD, you're at kind of a little bit of a special risk. Not that it can't be managed, but I think you have to be really wise about the medications. I would say if you're taking Wellbutrin and you're getting benefit from your ADHD symptoms, beautiful. I would stay with it because Wellbutrin has other benefits as well from an addictive point of view, depression point of view, and so on. So if that works, fine. But I would be cautious about the traditional amphetamine-based ADHD meds like Ritalin, Adderall, Vyvanse. They can be really tricky for people. And I've seen them actually cause relapse for amphetamine users.
Well, and I think it is extra important that you're a medical professional. Ideally, you have someone who's qualified. ASAM, American Society of Addiction Medicine, has a number of addiction medical professionals, and having them know that you are addressing your addiction and the diagnosis with ADHD. It is different because I think addicts can show up looking like we have ADHD even if we don't. Lots of us do. I do. But it's one of those things where making sure that they're understanding all of the aspects of how this is showing up so that they can properly medicate if necessary. I think, I know lots of people in addiction recovery, and I know lots of people who have ADHD. And so, like, we find the techniques that help us, and it could be medication assisted, but it's also, what are the techniques that, we have phones that have, calendar reminder, like help me navigate the day or whatever. So there's lots of ways that we can lean into the recovery regardless of having ADHD. So but yes, paying extra attention to that. You were talking about like the little kick. I still think that B vitamins, because they provide energy, I should feel them. Like, I've been taking B vitamins for decades, and like that's just my addict brain. They don't. I
Just
so
going to run right out and check that out, Tammy. Thank you for that.
no, I don't know. It's like all of those things. It's like, I take a pill, I expect a result, and
Right,
like that's just
exactly.
my head. And so, like, I do a
Yeah.
lot of telling myself that it's just a vitamin, it's for your wellness, so uh,
And
but it's really important that we pay attention to that.
I want to just say too, I think sometimes um, if we are in an addictive place when a professional is trying to diagnose us, we can get some faulty diagnoses. So, for example, like you just said, a lot of times an addict looks very much like they have ADHD, especially amphetamines or a sex or porn addict. Their brain is kind of zipping all over the place and not focusing on one thing and jumping around. And to somebody who is unaware of the addictive process at work, that can look like ADHD. I've had a lot of people even diagnosed with far worse things, schizophrenia. A meth addict diagnosed, they don't have schizophrenia. Once they sober up, they're perfectly normal. But so it's difficult for somebody to really accurately diagnose such a thing if somebody's using or acting out. So that's another factor in that diagnostic piece.
So thank you. And that was Stratera Meds. And would there be a place that would understand the coupled addiction and ADHD? So I always say find an ASAM, American Society of Addiction Medicine. They are addiction medical professionals, psychiatrists, making sure that they also understand an addiction focus. They don't all. So it really is like Dr. David said, buyer beware. Like, do your research and make sure that your professional has that. If you're working with a certified sex addiction therapist, often they have a colleague that they can refer to. They've got somebody that they trust that that can help with that as well. So other thoughts on that?
Yeah, that's perfect. Yeah, I would either psychiatry or ASAM certified doc would be the way to go. And if self-studying ASAM would be the ideal one for me, just like you said. Uh, yeah,
Yeah,
good.
like with all, lots of people go to their general practitioners and say, I'm depressed, and then they'll get medications for that, but it's out of context. And as much as I love my general practitioner, that person is not qualified to deal with all of this. So getting the right help, that understands, and being transparent. Like, this is not, I'm going to hide this from my doctor. No, that your doctor needs to know. You want the right help so that you have the best opportunity for success, and you're not given a medication that can provide, stimulant type things, as tempting as that is. So, but
Exactly. Yeah. Perfect.
other questions? Oh, good. We have another question. Oh, a big thanks. Well, thank you. Yeah, yeah. Yeah. So because I was talking to somebody, and I was talking about how you and I talk often about, like the opiate crisis, always, gets all of the news prints and things like that. But there's so much going on, and it seems like every time we talk, there's a little bit of a nuance with, what's really showing up in the world, and in the stimulant world. Any input, any news on that aspect?
Yeah. So you're right. I think the opioid epidemic, which is certainly horrible, has gotten it's really taken all the oxygen in the room. And in the US right now, actually, particularly in the US, in the western part of the US, methamphetamine hospital admissions, overdoses, and overdose deaths actually outpace the opioid epidemic.
Hmm.
And the death part is largely due to the fentanyl creeping into the meth supply now, which makes it particularly lethal. So yeah, I mean, it's a huge problem. So we can't kind of talk and chew gum at the same time, apparently. And I think that may be too with certain who's being affected by which drugs. A lot of times the people that are suffering from amphetamine use are maybe less relatable for people. They may be, queer folks or people of color or sex workers or the kind of people we don't necessarily identify with necessarily. But, that's a big problem. And now it's creeping in everywhere else. We've seen it. I mean, at Seeking Integrity, my God, when we started it together, right, in what year was that, Tammy? I get so confused because
To 2019, we started, we
okay,
opened the
because
residential program. Yeah.
of the pandemic, I'm like, the
I
timing is all
know.
screwy.
Yeah.
But when we started at 2019, we would get chemsex users, we get sex and porn addicts. And over the years since, every year we see more and more these, straight white heterosexual guys coming in for sex and porn addicts, and they're starting to use methamphetamine and cocaine and all the kind of traditional chemsex behaviors, and their arousal template expands beyond, heterosexual females to transgender people and sex workers and men. And how many calls from women is my husband gay because, blah blah blah. So it's the same behavior now that we're seeing, that we've seen in all these populations in chemsex. So it's spreading. So I anticipate, and I hate to see anybody get swept up in this particular addiction, but I think it may actually put some more focus on it and get more attention. So that's one thing, that's the trend, that more and more people are doing the same kind of stuff that we've thought only happened in the kind of the dark corners of the world for chemsex. So it's becoming more mainstream, if you will. I'm sorry to say. The
And
other thing,
go ahead.
go ahead. Well, I was just going to talk about the lethality of meth, particularly. I think I've mentioned that before, but um, and I hesitate to say in the good old days, but in the good old days of the meth epidemic, back when I started working this 30 years ago, methamphetamine was often home brewed, if you will, homemade, so-called mom and pop hookers, a la Breaking Bad. That would you take thousands of Sudafed tablets and add them with stuff from Home Depot and boil them and bake them and freeze them, and voila, at the end you have some methamphetamine. And so the federal government, a long time ago now, 20 years ago, passed this Combat Meth Act where they eliminated or rather prohibited how much Sudafed we could buy. So, you put it at the drugstore, you show your ID and get one package. So all the traditional way of making meth was wiped out. In stepped the drug cartels. and they revised the formula, and instead of using Sudafed, they're using other drugs as what we call the precursor, the base element. And so the meth they're producing now is really particularly toxic. It's called dirty meth or super meth, and it's causing all these really horrible, even more horrible side effects. So we always got psychosis. I would typically, my clients, if they were on a meth run, would sober up, and they'd hear voices and be kind of suspicious or paranoid for a week or something and then clear up. Now we're seeing about 30% of people using this super meth, they get psychosis and they never clear up. They're on permanent antipsychotic meds. So I still have clients a couple years into recovery, still hear voices in the air conditioning vents and that kind of stuff. Still don't quite trust people. They're suspicious, think people are talking about them behind their back, that kind of stuff. They shouldn't be locked up, right? It's not that kind of psychosis, but it's just really disturbing psychosis. The other thing we're having is massive memory blackouts from this meth. We never saw that before. People, we'd have blackouts. I'm an alcoholic. I know what a blackout is right from my alcohol days. I never saw an amphetamine addict having blackouts, and that's happening too. So all this to say, the trend is even for more dangerousness with these drugs. They're really plus add the fentanyl. I mean, it's really bad situation, uh, really bad situation. And the other thing I'll just say, the other drug that often we see in the chemsex world is what's called GHB, gamma hydroxybutyrate. It's a very close cousin of Rohypnol, the date rape drug, and we're seeing just this epidemic of sexual assaults in the chemsex community, gay or straight, doesn't matter. People are giving this drug to other people. And in chemsex, typically you're partying with people. It can be a weekend. It's not just one night, right? It's so you're the idea of consent. What is consent? I give consent, when I show up at somebody's house on Thursday to like use drugs together and maybe, have sex or something. But by Saturday night is a whole different crowd. And I'm certainly not giving consent to be, sexually abused and live streamed, which is what we're seeing now. So it's this really dark stuff that's happening, and it's sweeping up more and more people, straight and gay. And so I think it's just a real problem that we're still not really talking about as much as we probably should be as a society, because it's still a big secret. In much the same way sex and porn addiction was, I think for a long time, nobody really talked about it. And polite society, if you will. The same thing is now happening with chemsex. As it's becoming a normalized behavior, the conversation hasn't caught up yet. So I think we really need to keep talking about it. And it's not just affecting somebody else over there. It's these nice suburban husbands that are being swept up in it, that who would have ever suspected that. So it's an issue. It's an issue.
It is. I would, you talked about, and I just heard today, I got a notice that someone, um, it- the ex-spouse of a betrayed partner that I had met with at one point, her husband overdosed last week. I'd say in our age range, Caucasian, so yes, it's not the whatever you're perceiving could be that, person. I don't know the
Exactly.
substances. I don't know what I don't know yet, what drugs were used, but yeah, I don't know if it was intentional. I don't know if it was accidental. I thought it was accidental, but I can't tell you that for sure. So, but it's just, it is sad. And I don't, like you go, it's this overwhelming thing. And so I think part of it is like, we just go, oh, I don't even know what to do with that. So I'm gonna not think about it. But, to me, it feels like at some point we have to figure out where is this starting, and it might be the two beers like you're talking about, like how does this all get, so at some point identifying, it starts with the two beers and the next thing I'm, in a party on Saturday with whomever, I don't know, I don't know,
Right.
and I do know and it's younger people. And, we've talked before about, cannabis on young brains. And I mean, it's not good for old brains, but, oh, well, and we've talked, well, I
For
just heard
sure.
another statistic about like, it's people our age, that are, retired and I think perceiving that it's the pot of yesteryear, and are, are really struggling with overusing, shall we say, cannabis.
I mean, and I don't know of any good data on this, but I just know from word of mouth. I live in Florida. There's a lot of retirees here. You're in Phoenix, a lot of retirees, and like everybody I know is taking gummies, right? Older people to sleep, to relax. It's just become commonplace. And gummies are strong. There's now super gummies I've seen on Facebook. You know, hundreds of milligrams. It's just ridiculous. So I think it's just become more common, and that in drug prevention talk, they talk about this concept of dangerousness. And for cannabis, that's just kind of gone away. Um, and it's said, and I think we have to be wise about how we say this and not be hyperbolic. But there's a true danger here, and I think it's just become so common. It's a problem. The other thing I was going to say, you're talking about how do we start this conversation and what are the kind of roots of this? Certainly, maybe early use of cannabis and other kinds of drugs that we think are harmless at this point. But I think also the loneliness that we're seeing
Mm.
as a society, this kind of epidemic of loneliness and people not knowing how to connect. I think we as humans are wired for connection, right? It feels good. We want it. But I think more and more as a society, we don't know quite how to do it. And so I think these drugs and behaviors form kind of an artificial way of doing that because it's a quick hit, it's cheap, not not socially certainly or personally, but I mean relatively cheap way without much effort, much risk. At Seeking Integrity, we do a lot of work with the guys on vulnerability and trust and kind of what I would call intimacy skills. How do I how do I reveal myself as a person to you, and how can we connect at that level? I think as a society, we don't do that very well. And I mean, these are huge questions, right? That you or I can't solve. But I think I think people are walking around more at risk than they were maybe 20 years ago because of this loneliness, this feeling that we're not connected. I think that's all something that people are trying to self-medicate in many ways.
It was interesting. I watched a little snippet on a program this weekend, and they were talking about there are school systems that are making the kids lock up their phones. No phones for like the school day, and they were talking about to these kids about it, and at first they're kind of going like, yeah, almost withdrawal on that, but then they were like. But now at lunch, we're sitting and we're talking to each other. We're not just
Yeah.
with our heads down in the phone. And I thought, wow, that like I was honestly hopeful because I was thinking, because I do feel like, many of us are disconnected. And I was hopeful
Mhm.
that like they're going to connect and have more secure attachments,
Yeah,
in this. And not having their devices where they're just they did a pep rally and it was cute because like there was an actual photographer taking photographs, but it wasn't everybody just holding up their phone videoing it. They were actually
right.
experiencing it. And I thought, so now you're part of a community experience versus you're just viewing it through the lens of your phone like there was always this like one distant thing off because we're recording rather than being part of. So
Totally. Exactly. I was traveling this summer and in a museum, very well-known museum in Europe. And I was kind of astounded because I was one of the few people just walking through and looking. I think everybody's going through taking pictures of it. It's like, just like you said, the experience of it was filtered through their camera and their lens, or they were taking selfies, without really noticing what's around them. Um, yeah. So I think I've actually tried myself to do kind of homemade digital detoxes once in a while for a day or something. It's hard. It's hard. I get it, but boy, it's important because we do relate to each other in a totally different way when we're not communicating through a lens, for sure.
well, and technology, like this is there's opportunities within it, but yes, I think it's one of those, I like our social media is not who we are, and I think we can get caught up in some of those things with our self-worth as well. So we really
Yeah.
would like questions because you can tell we can talk about extraneous things. So, but you've Dr. David Fawcett. He wrote Sex Under the Influence, about sexualized drug use. He wrote Less Men and Meth. So he is a world
Oh,
renowned,
can I put in a
and
shameless self plug?
it's not, it is a, please
Um,
do.
so um, you mentioned Less Men and Meth. It's about chemsex in the gay community, and sexual influence is more how that's spread and generalized. But I'm coming out later this year with a study guide to Less Men and Meth, which is an update on the book and a series of questions. And I don't know if you can see the cover.
Hold it
It's
right in front of
probably
your
too
face.
blurry.
Yeah, hold it.
Like that.
There you go. Oh, it's starting.
That's
Okay. Well,
that's the.
okay.
Let me just hold on a second.
Take the
Bum, bum,
blur
bum, bum,
off.
bum. Yeah, take the blur off. There.
There you go. Yes.
Isn't that
Excellent.
pretty?
Excellent. Yes, it is. And I'm glad you're doing that. And like when we talk, it's like every time we talk, there's something new. So yes, the having an update is a great opportunity. Oh, this is a great question. Can you tell us more about getting off cannabis and porn also, when both are an issue for people several years into recovery that keep slipping?
Wow, what a powerful question, because it's just kind of makes the point we made, is that I think in that case, one of the reasons for the keep slipping part is this ongoing, addictive processes that are still creating a little buzz. I wouldn't even say in the background, probably in the foreground. So yeah, I think they have to go. And there's support for that. I think both, if you talk to a doctor, physician, I'm talking about, both cannabis and porn don't have a withdrawal per se, like alcohol does, or opioids, or benzodiazepines, which have a physical withdrawal where you get the shakes, but both of them have very, very powerful psychological and emotional withdrawals. People become dependent on those drugs to form kind of a shield, to kind of drop into this zone, to be in a space, to reduce tension, to stop stress, to fill boredom. Um, and they're very powerful because they give instant what we call reward, right? They dump a whole bunch of neurochemicals into your system. And dopamine being one, we talked earlier, dopamine is one that makes us have experience pleasure with something and want more of it. But they dump serotonin, which is that, that's why people feel connected sometimes in these spaces, and adrenaline and oxytocin, the love bonding hormone. So all these feel good chemicals. So it feels good. And it's very distracting often, especially if it's included with sex, or because you engage that whole part of your brain. So it's a cycle that is a serious addiction. And in my mind, it doesn't really have any place in someone who's trying to stay sober. So I think your question was kind of what to do about that. And I think um, certainly all the principles of recovery apply. That that's a powerful enough addiction. I think that would justify treatment, in my mind, because we know from porn and sex, particularly, they're insidious, and that they're really hard to extract oneself from, because they're so woven into one's private life, and they're accessible, and they serve a purpose of sorts in terms of filling boredom or a lack of intimacy or whatever. So I think I would recommend some structured support, I'll put it that way, where you're in some kind of PHP or IOP, or even a residential treatment program, because what's underneath, and especially if this is somebody who keeps slipping, that's another, I would say, reason to get a higher level of care, with what we call it, meaning a structured support in terms of a program to help them deal with that stuff. Because it's not, as we've been saying all day today, it's not just the drugs, and we can't just take them away and all, problem solved, right? The drugs are serving a purpose in people's lives. I mean, when I say drugs, I mean behavior, like, and drugs, right? The whole addictive package is serving a purpose. It's not just randomly there. And it's I call it people's coping mechanisms. It's how they cope with stuff, or They don't feel, or they can feel boredom, or they can get excited, or they can feel connected, or it's all chemically based. So we take that away. Um, it's been serving a purpose. We have to figure out what that purpose is and figure out healthy ways to solve that. And that we've talked to today about intimacy, connection, how to do with feelings, how to self-regulate. All that stuff is important to learn. And it's all work that has to go into solving that relapse problem. And so, yeah, and the relapse problem, I think, is definitely related to that. I think sometimes a good addict can compartmentalize, well, sex addiction is my problem. Having affairs, that's the real problem. And that's where I've hurt my spouse so much, blah, blah, blah. And that's true. However, you can't carve that out from the cannabis and the porn and all the other stuff. It's all caught up in the same thing. You can't say, I'm going to work on this and ignore that. This doesn't work. So that's a very long way of answering. Given the fact that there's relapse involved, I think probably treatment is what I'd recommend in an ideal setting.
And I'm with you, and I put some resources in, including our residential treatment program. We've had people who have been on a recovery journey for years and, are still struggling. So, and then, you can try looking at a relapse autopsy. Like, because the relapse didn't happen when you acted out or used cannabis. It is like and whether it's a certain period of time, there are some people that are kind of like every 90 days and I said that's the cycle of addiction. So we've got some webinars on the cycle of addiction, so that may be the thing that's happening. So then how do you intervene on that before that happens? It could be, had a fight with my spouse, had the boss looked at me funny, if somebody said it, I don't know. And you don't probably know. So it's one of those, when did you give yourself permission? Not even in your conscious brain, but that when did you start to go, like there's a point where we go, yep, I feel slighted, I feel entitled, I'm not doing the self-care, I'm not doing my recovery, whatever it is, and so therefore I justify, or I don't even think about, I just automatically go do the compulsive behaviors. And then I've got the guilt and shame and go, I did it again. I'm never going to do that again. And then we will, because we haven't gotten off that it's not a fun merry-go-round, so, but yeah, there's more going on, and but I think people mistake that I acted out. That was when I slipped and relapsed. And I'm like, could have been 2 weeks before that, because something happened and I started doing things. And rather than looking and going, oh, I'm in my middle circle, what do I need to do to get it back in my outer circle? Slide right on into the inner circle.
Totally agree. I think, and then it's about actively doing the right thing, right? Not just ignoring stuff or resisting or fighting the urge. It's about jumping into what we know works in a positive way and taking those steps and being vigilant about it, because these things creep in. And as you said, it can creep in over a period of weeks or months, and the relapse starts long before we ever act out or put anything in our bodies. It's been set up long before.
And we need to tell on ourselves. We need to go to our 12-step meetings or talk to our accountability people and go, I am struggling. I want to whatever. Like, I know my pattern. I'm coming up on my, like, this is, I do this on a repeat cycle. I'm coming up on that. I need to be extra vigilant. Like we can intervene. It doesn't give us the, oh, I made it through that, so now I'm good. No, what we still need to be, vigilant. I talk about, I do my recovery work so that on a daily basis, I've got my little insurance policy that, today I'm pretty confident I can get through without, acting out. Tomorrow I'll do, I'll do what I need to do, tomorrow. But I don't get it. I'm never all fixed. I'm not all better and never need, like, this is a daily thing. So, but I hear in the struggle that you're not there yet. Like, you're still struggling. So you've been doing some recovery work. I recognize the name on here, so I know that you come to our webinars, pretty regularly. Great, but yeah, there's something, that's hijacking and keeping you from being in true recovery.
The other thing, we haven't mentioned the word yet. but a big something that plays a role in this often is trauma, and trauma, historical trauma, or more recent. But I think that also, if that's unresolved, untreated, that can kind of be a force, an unseen force, kind of pulling strings in the background, and so I think that there's some there's layers of work here, right? The immediate stuff, like you said, the daily things to kind of buy us that insurance, that not a guarantee, but you know, probably we can make it through the day. But there's also the long-term stuff too that needs to be addressed over time. That the old wounds and pains, the beliefs about ourselves, the what a therapist would call a negative core belief. I'm unworthy, I'm unlovable, the one I hear from chemsex people all the time is I'm damaged goods. And it's like this hopeless um, feeling, and that's all our brain kind of playing tricks on us. We really need to rewire some of that internal software to help us kind of reframe both our situations and what we can do about it. Because I think sometimes we just go to the addictive behaviors without really trying the other stuff that actually works.
And it's challenging because, I hear often people are running off to do the trauma work and they don't have any foundation of recovery. They are in the, yeah, and guess what? The trauma work can be, it can be really triggering. So you need to
Yep.
have, and again, why, a higher level of help, could be really helpful because that will be the safe container, hold the space so that you can look at and have a plan for addressing, those deeper things. So I don't know, exactly what you need, but and and I love that Dr. David said layers because yes, like there's more layers. And in my journey, fortunately, doing layers of trauma work have been just that. And what a gift because I thought, oh man, if this had come up like early on, I don't think I would have ever gotten in recovery. It's like it would have just too much. That was exactly why I was, not in a sober state because, I needed those maladaptive coping mechanisms. So it is a place of solid recovery. And okay, let's pick away at that. I remember Dr. Rob, somebody was on one of the webinars and they said, it was like too much what they're doing. And he said, tell your therapist that you need to, slow down the pace of the trauma work because, this person was fearful that they were going to relapse. Like advocate for yourself. Like I need the
Yeah.
space to integrate this and then we can do more, but it is literally a bite at a time. And I've been in recovery a long time. Dr. David has as well, and I've had some realizations of extra things in the last couple of years. It didn't keep me from being in recovery, but it was oh, that's interesting, that's another piece of the puzzle, but I didn't have to know that in order to get and stay sober.
You know, I'm a trauma therapist myself. I always talk about it being an art and a science, right? The
Yeah,
science of trauma work, we know that's the technique. Okay, I do EMDR, for example. I know the
I
EMDR
love that.
techniques and
Yeah.
how to apply them and so on. They're very powerful, very effective. The art part, though, is knowing the timing. Exactly what you just said, Terry. If there's somebody too early in recovery, it's a huge mistake to start trauma work because we're overloading that person's ability to not only integrate it, but to survive it. Because it's trauma work can hurt. It's painful, almost by design. Doesn't have them. Good trauma work obviously minimizes that to the extent possible. But if we load that on somebody too soon, and it's variable. I can't. There's no magic number. For some person, it might be 90 days. Some people might 30 days. Some people might be a year. But just you really have to work with your therapist. And I love what you said about advocating for yourself, because that therapists aren't all knowing, right? We do the best we can, but we need the feedback, and people need to really speak up because it can be too much. It really can. It's a great insight.
Yeah, well, they're there to help and guide you, but they need the data of like,
Right,
where you're at with things too. So it's just like we were
right.
talking about with the ADHD. You need to have a professional that you've told, I'm struggling, with addiction and I think I have ADHD or I've been diagnosed with ADHD. They need to the professionals need to have the information. And I will, because we're kind of on this topic, lots of people unfortunately go to their therapists and lie for months and years. And with addiction, we kind of expect that. But at some point, the therapist is only going to be able to work with what they know or what they, you know, the good CSAT, like Dr. Rob says all the time, like I expect you to lie, early on, and we're going to work, on changing that. But if you really want to be on a recovery journey, you doing the best that you can to share the truth. Therapists aren't looking for you to go, oh, I'm being such a good, client. I'm doing everything right. No, bring the stuff that you need help with so that they can help you do life in a different way.
Exactly. Yeah, totally true. And therapists aren't mind readers, right? So,
No,
and
no. Lots
addicts
of
can be
therapists have
manipulative.
oh yeah,
You
yeah.
know,
And
uh,
and I understand a lot of it starts with denial as I'm lying to myself, I can lie to myself, for the long haul. So yeah, so yes, but at some point, what is the goal? And if the goal is I want to do life differently, I don't have the tools. This is a professional that can help me. Like I need to be willing to trust that process, and see. So
exactly.
okay. Well, thank you, Dr. David. It was lovely to see you. Congratulations on the new book. When do you know when
Me
that's
too.
going to publish?
Hopefully by the end of the year. I'm not sure
Okay.
exactly, but yeah, yeah.
Okay. Well, stay tuned,
Thank you.
everyone. So we'll see you
Indeed.
in a couple of months. Bye, everyone. Thank you.
Thanks, Tammy. Bye bye.